Hello, I am Dr. Rajat Gupta, a board certified plastic surgeon working in Delhi, having experience of more than 1,000 body contouring surgeries. I am also the trainer of micro air and laser technologies. So, what we will be talking today about is body contouring for some females who have a lot of excess skin and fat in their lower abdomen. Now, you would be knowing that a lot of females, once they get pregnant, maybe one or two times, or maybe more, they increase in size and decrease. Now, every time they increase and decrease in size after pregnancy, the skin which is extra does not shrink completely. And such women actually tend to develop a kind of a tire in the lower abdomen, which has an extra skin and some amount of fat. These women may try to reduce all this extra flab of skin and fat by exercise, diet, but sometimes they are not able to achieve that. In fact, most of the time, even if they reduce the fat, the hanging skin will remain and they will never get back to their earlier shape of body. Now, this problem is very common and very commonly operated by us in a procedure called as lipoabdominoplasty. So, if you are someone who is considering liposuction, body contouring, or abdominoplasty, this video is for you because I will be discussing a case which I just did yesterday and I'll be showing you its immediate result. I'll also be showing you how the surgery is done so that you get to understand what gives you a nice hourglass shape in body contouring, especially for liposuction and tummy tuck. So let me show you a photograph of a patient who came to us and we did her surgery yesterday, and let us discuss what problem she has. So this is a typical female who after a couple of pregnancies started developing a lot of excess skin and fat in her lower abdomen, and however she tried to exercise, she couldn't lose weight, her excess skin and fat. The problem is if you have a lot of fat in this area of body, this all fat and excess skin adds weight to the anterior or the front of the body, and such women also start walking with a slight droop. So this is important. Why? Because they may start developing backache. So the problem is all this area needs fat removal and skin removal. Now, what we want to do is liposuction of upper abdomen, the flanks, these are called love handles, and the lower abdomen. One has to understand, once we do liposuction of all these area, this lower hanging skin will further become loose and sag. So we want this hanging of skin to be removed as well. Now, let me show you her profile views. Now, if you see her from her profile view, you would understand that this skin should be sutured to this skin. This all skin is extra. Now, once we remove this skin and this, you will be left with a wound, and this layer needs to be closed with this layer. This procedure is called a tummy tuck. So, you would understand that one needs removal of from here to here and here to here. This all skin needs to be removed. And then this edge of the skin needs to be sutured with this edge of the skin here. I always make sure that the incision or the scar is kept very, very low, which is called as a bikini incision, and is always hidden even if a person is wearing a very thin undergarment. Now, the other point to understand in this is what happened to umbilicus. If you see, the umbilicus also does not look beautiful in this, and we may need to make a vertical umbilicus, and it should be kept on the thinnest part of the waist and just below it. It should not be this low. So we are also going to raise the level of umbilicus and improve the shape. At the same time, what my endeavor is to always achieve an hourglass shape. So this is the kind of shape we want to achieve for this female. This means all of this fat needs to go and this skin needs to be pulled like this. How this is done? So we have two muscles called recti. They are usually joined in the midline, but as one becomes pregnant and increase in weight, these muscles go apart. Now what we need to do is suture this layer to this layer, this edge of the muscle to this, to bring them both inside. And this helps in achieving a thinner waistline. This is very, very important and called as divarication of recti muscle correction. Another important aspect which I use in my body contouring patients is a lot of fat is being removed from this zone. I would use this fat to augment the lateral hips. Now when I augment the lateral hips, I always discuss with patients what kind of results they want. Not everyone want an African buttocks, but I add a bit on the lateral butts, not to make them wider, but just because I can achieve a nice hourglass shape for such patients. So the waist goes in and buttock slightly goes out so that they get an hourglass shape result. So the pictures which I showed you are for a patient which is yesterday. Let us see her results after I open her dressing today morning. So here is the result. I've just opened the dressing. She's just 1 day after surgery, and you can see that she has got a nice body shape, a linear central etching. Now linear central etching is important because it gives you a very natural and athletic shape, a vertical umbilicus, and a scar line which is hidden inside the undergarment. Now this is a huge change from her existing body shape in just 1 day. Let me show you the comparative pictures of before and after. So I'm showing you comparative picture of before and after keeping together in just 1 day. This is day 1 result. Remember, the result will improve over the next few weeks as the swelling and bruising will settle down. But you can see a huge change immediately. You can see that this all skin has been removed. This fat has been removed. The umbilicus has been contoured. She has got an hourglass shape. And yes, she's extremely happy. She's very, very happy. She tells me that she was like this when she was something around 17, 18 years of age. And in fact, she says that shape was not that good because she was flatter. She didn't have skin excess and fat, but she never had an hourglass. So we could give him an hourglass shape because we use this extracted fat and put into the lateral hip dips correction. So this is a very gratifying procedure. Patient walks back home the next day. She can resume all her daily activities. We ask them to take it slightly slow and lightly for next couple of weeks. And after around 4 weeks, they can start with their exercises, and 6 weeks, they can start their weight training. A very gratifying procedure, a result which can be not matched by any other surgery or exercise. A woman who needs a lipoabdominoplasty, they cannot achieve such results with any other procedure or exercise. So make sure that your surgeon knows what a high definition body contouring is, what is waist contouring, what it takes to do an hourglass shape, a linear etching, or a vertical looking umbilicus. One has to make sure that the tools like micro-air and razor are used so that we can help get you a faster recovery. My patients go back home the next day, I said, and resume their daily activities. I've tried to answer most of the issues with abdominoplasty. If you have more questions, keep posting your questions here and I'll be there to answer all of you. Thank you. Looking forward to hear from you.